Quick note: this is an automated educational summary of public medical sources: Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you've been feeling tired, having joint pain, or wondering about your health without visiting a doctor's office, you might have heard about blood inflammation tests. Here's what Mayo Clinic and the NIH actually say about them. Inflammation markers in your blood can help you and your clinician have a more informed conversation about your overall health. We're breaking down what these tests actually cost, how they work, and how you can order them online without a doctor visit. But first, these tests are tracking markers, not diagnoses. Always discuss your results with a healthcare provider. According to Medline Plus, inflammation markers are proteins and molecules your body produces when responding to stress, injury, or infection. The most common tests measure C-reactive protein, or CRP, and ESR, erythrocyte sedimentation rate. The Cleveland Clinic explains that elevated levels might suggest inflammation, but they're not specific to one condition. Your immune system makes these proteins normally. High levels can indicate infection to autoimmune activity, which is why these tests don't diagnose anything. They just give you data to discuss with your doctor. So how much do these tests cost? Direct-to-consumer labs like Quest, LabCorp, and WellnessFX typically charge between $30 and $80 per test. A basic CRP test runs around $35 to $50. A comprehensive inflammation panel, including ESR, costs $60 to $85. The CDC notes that without insurance, these are among the most affordable preventive blood tests. If you have insurance, your copay might be covered entirely. Many wellness platforms bundle these tests into packages at slightly lower costs than ordering individually. The process is straightforward. You order online and get a lab requisition. You then visit a local lab center. Most cities have one within miles, at a time that works for you. No appointment needed at many locations. A phlebotomist draws a small blood sample from your arm in about 5 minutes. The sample goes to the lab, and results typically come back within 1 to 3 business days through a secure online portal. You can view your numbers and download a PDF. No doctor's office visit. No long wait times. It's genuinely self-directed. The biggest direct-to-consumer lab companies are Quest Diagnostics, LabCorp, WellnessFX, Everlywell, and Let's Get Checked. You visit their website, search for inflammation tests or CRP tests, pay online, and get a lab location finder. Most urban areas have multiple lab centers you can visit same day. Rural areas might have longer drives, so check the location map first. Some platforms offer bundles with inflammation markers, lipid panels, and metabolic tests. If you're already using a telehealth service like Teladoc or Ro, some offer discounted lab ordering through partners. When your results come back, you'll see your actual number and the lab's reference range. According to Mayo Clinic, a CRP level below 3 milligrams per liter is typically normal, though some labs use slightly different ranges. ESR normal ranges vary by age and sex. Here's what matters. These are just numbers, not a diagnosis. Your results are a data point your clinician can use to understand whether inflammation might be a factor in how you're feeling. Elevated levels don't automatically mean something is wrong. They mean it's worth discussing with someone who knows your medical history. Once you have your results, bring them to a conversation with your doctor, nurse practitioner, or healthcare provider. Share your concerns, fatigue, joint pain, or a baseline. They'll review your numbers in context of your symptoms and medical history. The NIH emphasizes that inflammation markers work best as one piece of a bigger picture, not alone. If levels are elevated, your provider might order additional tests or suggest adjustments to diet, stress, or exercise. If they're normal and you're feeling good, that's also valuable information. Before we wrap up, let's be clear about what these tests can't do. Inflammation tests are screening tools, not diagnostic tools. They don't tell you what's causing inflammation, only that markers are present. The Cleveland Clinic notes that stress, poor diet, and lack of sleep can raise markers temporarily. Normal markers don't rule out inflammation-related conditions. These tests work best combined with a clinical conversation, not instead of one. Never make major health changes based solely on test results. What type of health tests are you interested in? Comment below and we will make a video about it.